Hey, hello everyone. Good morning. I'm Maria Fernandez. I'm the Vice President of Population Health and Implementation Science at UTHealth Houston. And I'm also the Director of our Center for Health Promotion and Prevention Research here at the School of Public Health. Thank you so much for joining us today for this important event. Today we are going to honor Dr. Grace Butler with an award that I'll tell you a little bit about. But I want to let you know that this is just the start of several activities that are going to be happening around honoring Dr. Butler and some work that we're going to be doing related to continuing her legacy of prevention of colorectal cancer. We're going to be advertising about these events, and they're going to be held in March, which is Colorectal Cancer Screening Month in 2025. And they're going to include sort of a kickoff event, and we're probably going to have the inflatable colon, and we're thinking about some other fun activities. So I hope you stay tuned for those things. But today, it's my distinct honor to introduce Dr. Grace Butler, who's been selected by the faculty of the Center for Health Promotion and Prevention Research to be the recipient of the 2024 John P. McGovern Community Leader in Health Promotion Lectureship Award. The annual John P. McGovern Award Lecture Series in Health Promotion was established way back in 1996 by Dr. McGovern to acknowledge the important role that health promotion plays in population health. And each year, we honor researchers and community leaders who've made an invaluable contribution to health promotion and prevention. And I hope you all had one of these pamphlets. You can read all about Dr. McGovern. You know that he is was a physician and supported our university in many ways, including the McGovern Medical School. And he reached out to the former director and also former dean of our School of Public Health, Dr. Guy Parcell, and talked about the importance of health promotion in population health. And this was something that he recognized that the Center for Health Promotion was doing well, and wanted to give the opportunity through his generous gift to bring leaders in the field. And over the years, we have awarded the John P. McGovern Lectureship Award to scholars in health promotion who've made significant contributions to the field and to theory and methodologies and research, and also, importantly, to community members who, through their tireless work, have made a huge difference in population health. So Dr. Butler is highly deserving of this award. She's a leader and passionate champion for colorectal cancer prevention in Houston and across the country. She's the founder of Hope Through Grace, a nonprofit organization devoted to the prevention of colorectal cancer through awareness raising, education, and linkage to early detection services. As a colorectal cancer survivor herself, Dr. Butler has been a longtime advocate for cancer screening and prevention, particularly among the medically underserved through education, fundraising, and policy change. And I think it's particularly fitting for Dr. Butler to be the awardee in 2024, because we also have two other awardees who are going to be talking about equity and health promotion, and that is Camera Jones and Amelie Ramirez, who will be giving their lectures in the fall. But Dr. Butler has the distinction of being the Community Leader awardee, and the only one that we have in 2024. Dr. Butler has received numerous distinctions in her career. She received a PhD in Higher Education Administration from New York University. She mentioned to me today that she did that in 2 years only, so motivating factor for some of you students who are still struggling. And she's held faculty appointments at The Ohio State University, the University of North Texas, Texas A&M University, and the University of Houston, where she now holds the honor of Professor Emerita. She served on boards at the Texas Children's Hospital Cancer Center and the San Jacinto Girl Scouts Council Board of Directors, Camp for All Founding Board of Directors, the American Leadership Forum Gulf Coast Chapter, and as an advisor to the director of the National Cancer Institute. She was invited to speak to George Bush about the importance of colorectal cancer prevention and served on the Texas Board of Occupational Therapy Examiners. So just another word about her role as on the NCI Directors Liaison Consumer Group. This is a group that provides critical insight for the National Cancer Institute and their decision making. And I hope she'll share just a little more about the exciting moment when she received a call from the White House. I met Dr. Butler about 20 years ago. And when I was thinking about it, I actually couldn't believe it's been 20 years. When she became a member of the Latinos in a Network for Cancer Control, we call that LINC. And this was a group that was funded by the Centers for Disease Control and Prevention and the National Cancer Institute with the goal of increasing the use of evidence-based interventions in practice. So doing what works, right? And increasing population health by ensuring that we're implementing those technologies like cancer screening that we know works and can save lives. Since then, we've collaborated over the years, and our programs have benefited greatly from her wise advice, her passion for health equity, her humor and warmth, the winning smile, which you'll see in a moment, and probably most importantly, at least for me personally, the way that she continues to inspire us to move forward and make a difference in this world. So please join me in congratulating Dr. Butler and welcoming her to the podium.
Thank you.
I'll just hand this to you and we'll take a picture.
Now?
Yep. All right, thank you. And we'll take more later.
All right.
Thank you.
All righty. Good morning, everybody.
Good morning. Good morning.
Everybody awake? Okay, I want you to stay awake for the next 30 or 40 minutes, okay? Don't go to sleep on. It is such a privilege, such a joy, and I am just beyond myself, really, in appreciation and gratitude. Dr. Fernandez and Rashonda right here, she was one of the movers and shakers a long time ago when we first met. It is my joy to be here. I'm going to share with you much of my journey, but I am also going to challenge you to think about your journeys. Mine is not the only. We all have journeys. Mine had to do with colon cancer. Your journey, your challenge is what it is. The point that I make here, there are pathways. And each of us can choose. Is this a destination in your life, the challenge that you're facing, or a transition from one place in your life to another and another? And that's how I approach this presentation that I'm giving to you now. Let's see if it's going to work. Where's Frank?
Okay.
All righty. Worldview. We all have a worldview. You go through whatever you do every day. You work, you study, you do whatever you do, and your worldview is centered around your interests, your priorities, and so on. My worldview was one of wellness. I ate well, vegetables, and so on. I exercised well. I took the FOBT every year, and I weighed about 25, 30 pounds less than I do now. Health, that was a part of my worldview, and at that time, I'm thinking about retirement. oh, when I retire, I'm going to do this, that, and the other. And then life for me was good. Everything was wonderful. And suddenly, for about 8 months, I was ailing. And it was so nondescript. I had something going on in the middle of the night. I would jump up, run to the bathroom, and wait. And nothing. Go back to bed. There was no pattern. It would just come upon me, like once a month, then more frequently, every other week, and more frequent. And I'm going to the doctor. This is what's going on. And so finally, I received a diagnosis. You're having panic attacks. Take this prescription, I think it was Wellbrutin, is that right? For panic attacks. And that's what's going on with you. Wednesday. Well, let's think a few days before Wednesday. Remember pathways, now keep that in mind throughout pathways. On a Saturday morning, I was getting in my car to do what we do on Saturday, shop, blah, blah. And I felt something funny. Something feel funny. Sunday, gee whiz, I hurt. Monday, I'm in pain. And by the time Wednesday came, I was at my desk, University of Houston. I said, the doctors are not diagnosing me. I'm not crying. I'm gonna sit here, you know anything about medicine. I'm gonna find something about medicine that's gonna diagnose me because I got this pain in my side. And then the next day, Thursday morning, my daughter came. I'm really, really almost in a fetal position. And my daughter right here, Dr. Alethea Chisholm, waved your hand. She said, we're going to the emergency room. I said, no, I can't. I have class tonight. We're going to the I got class tonight. We are going. All right. That was Thursday morning. No, that was Wednesday morning. And I was admitted immediately under GI services. So, pain. I received pain medication, the most potent probably that there is to stop me from crying. Wednesday, Thursday, Friday, Saturday, Sunday. Enters, oh, I'm losing myself. Yeah, here we go. Sunday. I'm lying in bed. The gastroenterologist comes to me and he said, are you still in pain? I said, no, I'm not. You know, got good news for you. We didn't find anything. And so we're going to let you go home Monday. Now, when I was at the desk at U of H, I forgot to tell you, and I'm diagnosed as myself, I thought it either was appendicitis or an ulcer going on right here. That's what I was trying to diagnosing myself, y'all. I'm looking. And so he said, I have good news for you. We didn't find anything, and we're going to let you go home when the business office opens tomorrow, Monday. Now, this is a defining moment in the whole journey. I'm lying in bed. I'm looking at the doctor. And I said to him, I think you need to look at my colon. Where did that come from? Because I thought appendicitis and ulcer. But that's what I said to him. And he rather flippantly said, okay, we could do this or that. I forgot what the other one was. But I said, which is most precise? He said, which is most precise? He said, the colonoscopy. And I said to him, that's what I want. Then he said, okay, Monday morning, you've had nothing in my mouth the whole while you're here. Monday morning, we can give you a colonoscopy, drink a little bit, and you'll be okay. Monday morning, I had my first colonoscopy ever. This is important. I was 60-something years old, first colonoscopy ever. Now, the field has changed. At one time, it was at age 50, you get your baseline colonoscopy. Because there's a change now in the findings and the incidence rates, that now has changed to 45. Age 45. Anybody here 45 years old? I will be next week. But no, everybody else is younger, right? I don't want to embarrass anybody. Everybody's under. So you got some time to wait. But anyway, 45.
Yes, ma'am.
Anybody here 45 and you have not got your baseline color? Anybody? Oh wow, I'm impressed.
Okay, Daddy.
All right,
I was
she's
getting
been
45 or older. You mean
45 or older. Anybody 45 or older?
And not had a colonoscopy?
Everybody in here's got a colonoscopy already, so that's wonderful. That it really is one. Let me ask you another question. Do you know where your discharge papers are when you did your colonoscopy? You know where they are? I see 2 nods, 3, 4. There are more than 4 people in this room. About the rest of y'all. Discharge papers. You know what it says? 4 people. You know what it says? All right. That's important. Why? Because you're being rolled out on a, and here's one thing that I would offer to the profession. You're being rolled out on your wheelchair, you kind of halfway sedated, somebody takes you home and you finish sleeping. The important thing about that, and as I talk with a lot of people, they really are not aware. You ask, what's on your discharge paper? I don't know. Do you know where it is? Well, I think I can find it. That's very important information. First of all, it gives you the finding, what the doctor found. Second of all, it tells you whether you need to come back in 3 months, 3 years, 5 years, 7, and so on. If you don't know you've had a colonoscopy, if you don't know where the paper is, go home and find it. Now, first ever colonoscopy. I was not completely out. And I heard, what is this? This is the doctor speaking, the GI doctor. Let's look at this. Let's go back here. All right. When I finally am awake, the doctor comes with horrific looking pictures. Remember I told you what was going on? Awful. This is in my body. They take pictures. And if yours don't look too wonderful, then let's pay attention and get whatever is needed. The pictures that he showed me are unbelievable. And he didn't use the C word. He said to me, this has got to come out. And look, I'm one of the, well, if you got to come out, let's get it out. That's just how I said it to you. The surgeon then was called because those pictures had to come out. But what made me smile was this right here at this juncture. Finally, somebody realizes something's going on in my body. So I had to smile first because here, now this makes sense. All before, panic attacks, none of the other did not make sense to me. And so you have to be your own advocate. And if you know something is going on, then you insist. Immediate action was required. My whole worldview that I shared with you, everything now is in shambles. At best, my worldview, as I described, I would keep working until and so on. Now that worldview no longer is the same. It's sickness, it's maybe dying, it's making a decision, a determination. 2 pathways. And let me say, I'm speaking about colon cancer. Some diseases, there's not 2 pathways. I'm speaking about colon cancer. 2 pathways. One, is this a destination? Is this the end for me? How long do I have to live? 3 months, 3 years? or you can see and you can take it as a pathway. I'm not going to succumb to this situation in my life. And that is what came to my mind. Now, I'm sharing this with you. All of you in medicine, you know what a colon looks like. But let me take you for a second here. This is the appendix right here. This lower part, by the way, this is the ascending. Your colon has several parts to it. This is a cecum. And when you have a colonoscopy, go back and look at those papers. Make sure you see something that the doctor says, we reached the cecum. That is the entire colon. If it's less than that, then you have to ask why. Why not? And then your ascending colon, your transverse colon, your descending colon, the sigmoid, and this is how the waste comes out. Now, for me, I heard carcinoma of the colon, stage 3. This was foreign language to me. Stage, oh, okay, we're having a show here, and this is the stage that they're going out on. Stage 3. And what came out of that, I was given immediately an extended right hemicolectomy. Got it, everybody? No? Extended right hemicolectomy. This is the right side of my colon, your colon, our colon, and this is the transverse colon, which had to be an extended surgery. Here's the reason why. I told you I had pain right here. That was not the tumor, but it was something that got me into the emergency room and got the attention that I needed. The tumor was in my transverse colon. So in order to get that out, extended hemicolectomy. And thank goodness, if you're gonna get a bout with colon cancer, get it on the right side, because you need the rest of it to do what you need to do to take care of your body. All right. Having gone through that, oh, by the way, if you have questions, feel free to ask. This was a point in my whole life journey of destiny, of determination, and so on. Which pathway am I going to take? Is this a destination or is it a transition? Is it a transition from your worldview that you've known? Or is it a destination? How long do I have to live? Mine was a very clear statement. That was how I went through the whole experience. I will not succumb to cancer. Cancer is not going to take me, even though stage 3. And at one point, they suspected metastasis, so more tests were done to determine it wasn't stage 4. But I had a made-up mind. And in going through difficulty, it's always important to have a made-up mind. So now I have a different label. I'm now a survivor. There was so much that had to go on. I had chemotherapy from April until December. December came, I thought that was my Christmas present. That's when it was all over. It was not chemotherapy all the way through. There were times we had to suspend and wait for the body to do what it needs to do. But it took that period of time for me to be able to get on to another level. Exhilaration, yes. I have a diagnosis, yeah. I'm not just crying for any reason, but that didn't last long. When you're in the middle of all that and you're getting, I'm sure many of you have either gone through this experience or you've had loved ones who've gone through this experience. It's not an easy journey. And then you wonder, how did this happen to me? My worldview was one of health, and I was intentional about my health. How did that happen? Well, for one thing, as a person, a city councilwoman, every time I see her, and this is years ago, she told me, she said, And I did say this at one talk. If you're not, you know your body, if you need to get a baseline colonoscopy, and this doctor says, no, it's not time, let's wait, then you have to move on. It's your body. And you know your body. And the thing that I think is most important about this is that you must be intentional. It's your body. And if you're not intentional, it could be that this will just move on and not be noticed. Here was a tipping point for me, and this really is the beginning of why I'm here right now today. Let me tell you, this is the beginning of how I came here to be a part of cancer. I wanted no part of cancer. I wanted no part of cancer because cancer had taken away people that I love. And I pray, God, please don't ever let me get cancer. I'll do anything. And for 20 years, that prayer was answered. And then it was my turn. I didn't understand it. And there are times that we don't understand everything. But we know that March is National Colorectal Awareness Month, right? Colorectal Cancer Awareness Month. We know that. The two legislators who passed that legislation in Congress were Houstonians. That's Congressman Gene Green and Ken Benson. Those names are from way, way, way back. Some of you may have heard them. There was a press conference at MD Anderson. Yeah, she's back there. And I think the way I got on that panel, I've been trying to figure it out. Was it you? Yeah, Cassandra. We met somewhere, and that was a good beginning, Cassandra. Just want you to know that. I was there, and a vice president of MD Anderson on this panel, one of their doctors, Dr. Elise Cook, congressman, and a survivor, Grace Butler. And Cassandra was responsible. Cassandra was responsible for that. And that was the beginning. And at that session, my eyes were open. At the end of the press conference, the vice president said to me, I've been asked by the state of Texas to develop a strategic plan to address colon cancer in the state of Texas. And I'd like you to be on that committee with me. Sir, I almost laughed. I don't know anything about cancer, but I'd like you to be on that committee with me. I can't help you because I don't know. And then I got to the vernacular. I don't know nothing about cancer. Get down to the vernacular. I don't know. Well, he prevailed. This was a committee comprised of doctors throughout the state. It was a statewide committee. We met in the theater-style room at MD Anderson. And we met for probably about 8 or 9 months to develop this strategic plan. Now, you must listen. Here's the beginning. In one of the meetings, most of the people in the room had white coats. I had on yellow. In one of the meetings, this is important. One of the administrators, and I'm not calling the name of the hospital, from Hospital A was speaking. He said last year, we went into the underserved community and we had a pilot project. And with the pilot project, we were screening baseline colonoscopy. And he said, we found disease. And when we found disease, we sent them to Hospital B for treatment. And Hospital B is saying, why are you sending us all these people? We can't take care of them. I'm listening to this. And as a result, Hospital A says, we no longer will have that pilot project. Sir, if you don't have a pilot project again, what's going to happen to those people? There was a person sitting up here at a desk, moderating the meeting. At the end of my question, she said, let's take a break. Now, I wasn't too happy about that. Should I stop? Should I just quit? No, I continued. Well, we got the plan. We're now in Austin with the plan that we've developed. And the same, very similar scenario. And again, I raised my hand. We've not really addressed the situation for uninsured people. What's going to happen? No one answered that second time. Now, there's a third, there are 3 distinct meetings that got me on this journey. The third one was back here in Houston on Richmond Avenue at the American Cancer Society office. I think they moved, but that's where they were. I'm in a smaller setting with a different group of doctors, gastroenterologists, and I asked my question the third time. If you all don't go into the community, the underserved community, what's going to happen to those people? Will they be left to die? This time, I did get an answer. There's a doctor sitting right here. He said, I used to be able to do pro bono. I can't do it. My malpractice has gone up and I can't. And so he gave me a lengthy reply. And listen. And then he said, now, to answer your question, I get emotional every time I say this. To answer your question, the answer is yes. They will be left to die. How could that be? I still have not, after all of these years, it bothers me. And so here go the tears again. I walked out of that room, I couldn't even see to dry. I had to get away. And I walked out of somebody got to do something. Who do I know? Somebody's got to do something. Well, I know Professor so-and-so in the engineering school, Professor so-and-so and business. Someone has to do something. And that thought would not go. It was just unbelievable to hear someone say that, yes, they'll be left to die because they don't have enough money. And I suspect today there might still be that same issue. And we've got, as a people, as a group of people who are concerned about others, let that be a defining position that you take away from this presentation. If that is going on, who is in your circle? It can't continue. No one should die because the money's not there. That thought would not leave me. It wouldn't leave me. And I'm sitting now in my kitchen, trying to figure out, well, I didn't find anybody at the university. Eventually, I need to do something. Well, my daughter said, I know a gastroenterologist. We went through residency together. Maybe he can give you some ideas. We took him to dinner, Dr. Ronald Coleman, and a lengthy dinner, a lengthy conversation. And at the end of dinner, I remember 3 words that he said. That was over 25 years ago. 3 words. I will help. And he was good for his word. And then I went back to Dr. Bernard Levine. He was the vice president, MD Anderson, who invited me to serve on this committee. I went back to Dr. Levine I want to start a nonprofit organization. Will you help? He said yes. Dr. Levine knocked on doors. He opened doors. He made Hope Through Grace have a presence in the community. He was there, and Dr. Coleman, who was a gastroenterologist, I will help message from him. Here's what we were able to do for that population. We did a lot of education work throughout the communities, workshops, counseling, and so on for the larger community. For that particular aspect of the community, here's what we were able to do. Hope Through Grace. We covered the cost of the baseline colonoscopy for that population of people. We paid the doctor's fee, the facility fee, ancillary staff fee, anesthesiology, and if tissue was removed, pathology. For every person who came to us, there was no bill presented to them. And let me tell you, folks, some of the findings, some of the people were normal. Some of them had polyps. And I've learned a whole new vocabulary about these polyps. Polyps, sessile polyps, diminutive sessile polyps, pedunculated polyps. These are findings of these people. They came to us only for a baseline. They were not sick. We were not providing diagnostic codes. We were saying baseline. And we're finding all of this. These are some of the findings that came about as a consequence of the baseline colonoscopy that was provided to them. So back to the education workshops and so on. This is the highlight of much of the curriculum. But the screening is what I want to tell you about. This third, for the people that we serve, there were some that we served who did have insurance, but the copay and the deductibles made it impossible for them. So we were able to assist them. We talked about the education program. Now here's something, this letter C, which is very important. Hold on to that thought. When the individuals found out this was a service that's available to them, they hurried on over to us, Hope Through Grace. And going through a series of questions. Do you have a doctor? No. When's the last time you've been to a doctor? I don't remember. What Hope Through Grace did, if you want us to pay for your baseline colonoscopy, you are going to establish a relationship with the primary care physician, and then you come back. You know what that does? That keeps people out of emergency rooms with non-emergency situations. Now they have a relationship. They now have moved from the margin of healthcare to the center. We asked them, where do you live? What's your zip code? Then we had a list of clinics. Here are clinics in your zip code. Now you go and establish that relationship. And that was one of the requirements to come into our program to get those services. You must have a primary care physician for several reasons. That's one. But the other, if there is a finding, the gastroenterologist who's doing the scope will not be the one to treat you. So you have to have a relationship with the doctor. That was a very key part of what Hope Through Grace was doing. And with the PCP, then whatever follow-up that was needed, they were likely to get that follow-up. I talked a little bit about screening, education. By the way, for those who wanted us to provide the colonoscopy, they were required to come to an education session. And we would say to them, it's going to cost you something. And then their eyes would kind of drop. It is going to cost you something if we provide this. And they're thinking about money. I'm saying it is going to cost you something. It's going to cost you time. And you're going to focus on it. You're going to learn something about health. You're going to learn something about your body. You're going to learn something. We have them to do the BMI scores. And I say, you don't like that number? It's yours. You don't like that number? It's yours. Then you can do something about it. And some of them, after we did that, they were really alarmed for that. Now, new beginnings. I've shared some of this already. Non-emergencies are no longer. Fewer lives lost. I told you about the list, and I have a chart here of the findings for the folk who came to us. All of them they all came for the baseline, not for diagnostic. I'm repeating that. But there was one person who, before she woke up, the doctor called me. Hello, we got a problem. Yes, what's the problem? We've got cancer. This lady was already at stage 3. And as we spoke to her, she said, I was bleeding, but I really thought I was going through menopause. We were able to get the care that she needed, one of the Bentab LBJ, I've forgotten which one. They gave more tests to this lady. She was upgraded, stage 4. She knew nothing about this problem, stage 4. But let me tell you, some years later, I received an email message, subject, I am cancer-free from that. That makes it all worthwhile, doesn't it? Yes. When you're doing something and you're realizing that you have intervened in a person's life and you have changed the course of their lives. She was very grateful. How many of you live in Harris County? Harris County. Well, guess what? You need to say thank you. You should say thank you. All these people that we found disease, they had no clue. We found it. And for every person who had something going on, we were able to provide the clinical care for all of those people. Had it not been found, you and your taxes support Bentab, LBJ, and you would have had all these people on your tax bill to pay for those services. So thank you. Say thank you, Hope the Grace.
Thank you, Hope.
All right. Have we done it all? No, of course not. Let me get you kind of situated on this chart. And this is about as recent as I could get. March of 2024. Looking at the state of Texas. Primary sites, colon, excluding the rectum, and the rectum. And then these are new cases divided by men and women, expected deaths, men and women. All right? Get your focus here. I'm sharing this with you. When we look down, expected new cases, we combine men and women in the state of Texas. We have almost 13,000 people who are expected to have colon cancer, 2024. And you have to wonder how many of those people may fall into the category of individuals that I just described. And as we move on, expected deaths You have almost 5,000 people in the state of Texas who will succumb to this disease. We have work to do. We have work to do. What more should be done? I suspect this list could go on and on and on. These are some of the things that I thought about. On and on and on. We need more organizations that will go into the grassroots communities. Do you know, anybody ever been in the back room of a post office? I've been in early in the morning in a big chasm and given a presentation to postal workers before they went to do what they needed to do. I've got HISD bus drivers before they get on the bus to get up to get. In other words, you have to be determined. There's got to be a determination. Go where the people are, wherever they are. Let me tell you this one. You smile at this. Workshop at our homeless shelter for women. I had 5 presentations with them. This is the very first presentation. And you gotta get used to graduate classes. They're usually 3 hours, right? And you have a break and then you go back for your next hour and a half. Is that correct? Everybody knows that. I was speaking to them about health and cancer and what happens to the body and some of the things that make you high risk, like tobacco and on and on and on. That was an hour and a half. And before the break, they didn't know I was about to have a break. Before the break, are there any questions? One lady raised her hand. She said, when are we going to stop so I can have a cigarette break? Wow. I just finished talking about the sensation. She didn't know we were getting ready for a break. I put my head, I really, truly, I didn't know what to say. I kind of put my head down and I collected me. So I said, who else needs a cigarette break? Hand, 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 all over the place. I said, okay, let's stop and have a cigarette break. What else can you do? I did. And then after the break, we all got back in the room. I said, now, I had something else I was going to talk with you about, but I'm changing my topic. I'm going to talk to you about something different. I'm going to talk to you about choices and consequences. Right down the spot. Choices and consequences. Tobacco and so on. Anybody in your family, you have children, secondhand tobacco. I talked about that, the choices that are being made and the consequences of family members, children, and so on for secondhand tobacco. And let me tell you, at the end of that second half of the session, one woman, she walked up to me, it seemed as though she must have had a whole pack. She had taken them all out of the pack. She couldn't close her hand. She said, I want to stop this. Can you help me? Yes. And I gave her services where she could go for tobacco cessation. Another woman in that class walked up to me and she said, I would like you to pray for me. Sure. We found a corner in the room. That's what we did. In other words, there's got to be a sensitivity to where people are. You have to take people where they are. If you're going to move them forward, you have to acknowledge where they are. Well, let me tell you, for about 3 or 4 or 5 years, I don't remember now exactly, I was in a medical center. I had tests that were supposed to be done. And early in the morning, somehow, the records were not there. The doctor was out of the country. And here I was trying to get done what I needed to get done. They couldn't find, it was a big problem, big deal. And so now it's about 5 o'clock. I'm finally leaving the medical center. You know how you have to go and pay for the card inside, and then you slip it in when you get ready to get to the gate. Well, I had my card, and I got to the gate, opened my window, and the person, they had a ticket taker, I guess to move the cars a little bit faster. At any rate, I got to the gate, they got to the gate, and I opened my window, and this person said, "Don't I know you?" And I was pretty irate at that point. I said, "I really don't know." "Yes, I know you. Don't you have a health organization?" I said, "Yes, I do." She said, "I was one of the women in your class. And I want to thank you for treating us with respect." At this point, oh man. And then she said, you know, the line of cars must have been getting pretty long, right? And she said, "I want you to know I got my children back. And I want you to know I remembered her after she started speaking. These are the kind of situations that have kept me going. These are the kind of situations that will keep you going. When you see a situation, you know, when you see a problem, and I had one of the administrators of Harry's Health System, who is a doctor, she said to me, "I don't know any doctor who would have done what you did with Hope Through Grace." I said, "Well, you know, I didn't know I was supposed to be afraid." And you have to step out. You have to step out and really take control of matters. And so this list right here could be double, triple, and so on. You find your place in what you can do. But I remembered the words of Robert Frost. Robert Frost, you know that. "I have promises to keep and miles to go before we sleep." We have promises to keep, y'all. The vernacular, y'all. If you are in the health profession at any level, whatever level, we have promises to keep and miles to go before we sleep. As the transitioning that occurred to me, I am not going to go over this entire list because it could be doubled and multiplied over. But let me point out. Let's take a look at this one. I received a call from the White House on a Saturday evening. I had done a workshop and I thought I was miserable. I was hurting, I was tired, I wanted to do nothing. I was in my bed. And the lady said, "This is the White House. We have an event next week and we want you there." "What kind of event?" "Well, we have not worked out all the plans, but the president is going to be there." "Oh, really?" This is true. I was miserable because I was tired. So she said, "Take this number down and call back and you see it really is the White House." And then I said, "Well, who gave you my name and my number?" I said it just like that. And she called the name, I still remember, Ann Leibowitz. Ann Leibowitz was on the staff at the National Cancer Institute. I had been a consultant to them for 6 years. I knew Ann Leibowitz. So when she said that, I said, "Okay, I'll get up and write your information down." I got to find a pencil and a pen, but I'll get it. And so I said, and then I thought, "Who pays?" She said, "Well, the White House cannot pay." I said, "Well," and she said, "Well, this is Saturday night now." She said, I'll call you back Sunday." She called back Sunday. There, "I don't have additional information. I'll call you Monday." Monday, I was away from the phone all day and had a meeting Monday night. When I got home Monday, they had been calling me all day, all these messages. "Okay, here's your flight. here's a limousine, here's the person, blah, blah, blah. Tuesday morning, I'm off to Bush Airport. Look, ladies will understand this, maybe not me. What about my hair? What am I gonna wear? I mean, overnight, and then what am I gonna say? So, okay, I got there, and Tuesday, Wednesday morning, I'm seated beside then President George Bush, right here, close enough to reach each other. It was a round table. At the round table, they had invited the head of all the health agencies in the nation. That's the CDC, the National Cancer Institute, the National Institute for Health, the Genome Institute, and then there's another one I forgot. And the purpose of the round, and the president, of course, the purpose of the round table was to implore the President George Bush to increase funding for health in the nation. Now, they told me when I got to the hotel up there, I said, and they told me who would be there. We couldn't give you all this information because we didn't want the press to know. But you will be last to speak. I don't want to be last. I'm thinking, something's going to happen. Secret Service will come get him and I won't have a chance. Anyway, the last person, is the one who really sets the tone for the send-off. I have learned that. It was probably one of the most impactful things that one could have done. And actually, when I finished, they told me, you have 3 minutes. I think in 3 minutes, I could have talked to the man on the phone for 3 minutes. Well, I had no time to think, right? I just got the call Saturday night and blah, blah, blah. I tried sitting up all day, all night, Tuesday. I'm flying and I'm sitting up in the hotel room trying to think of something I could say for 3 minutes. I couldn't. So I said, I'm going to talk. And when 3 minutes are up, I'm going to shut up. That's how I went to bed. At any rate, I'm sitting beside President George Bush and I'm talking to him. My communication had to do with the grassroots organizations in the community. People in grassroots levels, such as Hope for Grace, need help as well because they're doing a magnificent job. He did not take he was sitting on this side of me. I had no notes. Everybody else had notes. They were prepared. Maybe I was the last person they thought about or something, but there was no time. So I just talked to him. Mr. President, my name is Grace Butler. I'm from Houston, Texas. And this is, and on and on. And at the end, he slapped me on my back. He said, come on out here, I got something to tell you. That was George Bush. But it's one of those things that's memorable. I am going to show you one more, and then we're going to be the most memorable of all of these. There would be more, could be more. I'm standing here today. I'm still in disbelief. How did I get to be? And then I learned today, I thought somebody was just being nice. They said, well, she worked hard, let's give her this award. I learned that there was a faculty vote for me to be here today. I'm honored, I am humbled. I'm still trying to take it all in. But thank you all for listening. And I hope there's been something that you heard about pathways. Pathways. When something comes in your life, is it a destination, this is the end for me, or is it a transition? Thank you for listening.
John P. McGovern standing ovation. Dr. Butler. So what did I tell you? Inspiring, right? I mean, a person who sees an inequity and says, someone must do something, right? And then herself says, I will help, and then inspires other people to say, I will help. There was a couple people here in tears, including me. And we want to, in addition to the plaque, we also want to give you this. You don't have to carry it, don't worry. Beautiful flowers for your beautiful heart and soul. And thank you so much for coming. We're gonna take some questions if anybody has any questions or comments, and then we invite you to grab a lunch and stay and chat. We have until just a little bit before noon. Is that right? I mean, before 1, a little bit before 1. Does anybody have any questions?
I don't have a question, but I do not want to get emotional, but I want to say thank you so much. I have been impacted by so many people about with cancer. And I want to tell you of the support. Thank you for the support.
Let's reach out. Let's be in touch. I'll be in touch with you. Would you like that? We can talk. But choose the destination. Any questions, anybody? Yes, sir.
Thank you so much for this inspiring talk. In your personal journey, but journey of all others that you've helped, in addition to, post-screening, of course, there is a treatment element, but one of the important element is the social support that an individual needs, because cancer is like, as you yourself said, oh my God, a death sentence maybe, right? Does your organization do some sort of a social support? Do you have other organizations who do that? How does that work? Because, that is, I believe, equally important as the treatment is, isn't it?
Yes. That's a very good question. And let me tell you about Hope Through Grace. When I described what we were doing, covering all the expenses for the baseline colonoscopy, that's pretty expensive per person. What I described for you. We have been in what I call a level of hiatus because of just what you just said. There's a need to do more than what we did. There's a need for those persons who had disease to be able to follow up. I don't know if you are at a point where you want to say something about the more. But we are reaching out we had to go into a hiatus because the dollars simply were not there that it takes. Even though you see the mission and you see the benefit accrued, not only to the people who came for the screening, but to the community as well. And it's hard to understand why we couldn't continue. We've been in a hiatus, but I think we're going to blossom again very soon.
Yeah, and so again, as I said at the beginning, in March 2025, we're going to have sort of a big sort of kickoff event where we'll be talking about the future of Hope Through Grace and the support that our institution is committing to continue things. But I want to underscore, and this is related to your question, that one of the things that makes the organization so powerful, Dr. Butler's impact so powerful, are those human connections. The connections to individuals and organizations that make people stand up and say, I'll help, I will help. And no, not one group can do everything, but having these connections with organizations that provide social support, organizations that provide help with she was talking about BMI, with nutrition, physical activity, and then primary care organizations that can actually help establish that important relationship that she talked about with the primary care provider. So I think it's the tentacles out into the community And of course, Dr. Butler is famous in Houston. Everybody knows Dr. Butler. But also, the organization. And this is one of the things that anybody who's worked in public health knows it takes years to cultivate. And it takes years for communities, particularly communities that are experiencing disparities, to trust. And that's something that Dr. Butler has been able to establish for many years, is that trust. So.
And might I echo, me and Cassandra both were on her advisory committees back in the day. And there was Baylor, there was Anderson, American Cancer Society. Everyone was assigned a task. So she was definitely about bringing in this collective unit, like a true grassroots feel. You're at the kitchen table, you're gonna wash dishes, you're gonna sweep the floor. That was the task, and we got it done. I mean, she's done a lot of think tank luncheons that she was able to raise funds to support giving out those screening colonoscopies. And it's an honor. I know it's an honor for Cassandra as well. I can speak for that for sure. That we had our full-time job, but we had our full-time job with Grace Butler too. So.
Thank you.
It didn't help that I lived down the street.
Thank you so much.
So I just wanted to understand, I know that you said that you all help with the monetary values for underdeserved communities who need help with those co-pays, but as well as those that we're saying with those who have insurance, because it's still a lot to get one done.
That's right.
Having insurance. And I understand that y'all are at a point, but at some point y'all will be able to help with those monetary co-pays at some point is what you're stating, or only for the uninsured?
Well, as Dr. Fernandez has said, we're kind of back and
I'm going to
forth.
pass that over to
Okay. We're in process of having conversations.
Okay.
Meaningful, may I say meaningful conversations, because of the costs. We had to really downsize, you can understand that. And so many people have said, we still need the service. My phone didn't stop just because we stopped. People would need, and I would have to say, well, we don't have the dollars right now, but we're going to try to. And what we have done is continue to counsel with individuals who are going through that, and workshops. All you need is your smarts, right? You can do workshops. You don't need a whole bunch of money for that. So that has been the essence. We've not been able to sustain the cost of things, but we're having some meaningful conversations right now. And
you all, this group here is very instrumental in getting CPRIT grants.
all right.
And we know that the Cancer Prevention Research Institute of Texas does have resources to support screenings for people who don't have other options. So these are just some of the plans that we're going to be moving forward with to help make that happen. So I'm going to end now, but again, please grab a lunch and join us and come talk to Dr. Butler and amongst yourselves. And thank you so much for joining today.